There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, can a blood pressure pill kill you if you take too many? Answer by Douglas McCaleb. If the medication is to combat low blood pressure, then read this. High blood pressure, BP, caused by anything, natural or pharmaceutical, can have very serious and grave side effects and can even cause death. The aneurysm is one possibility. This is when the blood vessel's wall tension is no longer able to counteract the force of blood, BP. This causes a blowout and results in massive hemorrhage. This may occur in any blood vessel in the body but mostly in smaller arterioles. If it occurs in the brain and you survive, then this is known as a stroke. Permanent damage may occur. High blood pressure may also cause the heart to work harder as peripheral resistance has not changed. This means there is a backup of blood, and although the tissues are receiving adequate supply, the backup causes cardiac hypertrophy, heart enlargement, and may lead to heart failure. If the medication is to combat high blood pressure, then read this. An overdose of medication intended to lower blood pressure that is too high is very dangerous, and it completely depends on what you are taking because different medications will use different mechanisms. Here are some common examples. Angiotensin converting enzyme, ACE, inhibitors. For secondary hypertension, this drug inhibits the enzyme responsible for the maintenance of fluid balance. If your blood volume is too high due to excess salt, water follows salt, then an enzyme is released that is converted to an active form that causes you to filter and secrete sodium and water into urine. An overdose of this medication may cause hypotension, BP too low, hyperkalemia, cardiac implications due to high plasma potassium, hyponatremia, salt is too low, causes delirium and disorientation, and may cause metabolic acidosis, serious condition that if untreated may cause CNS depression and death. Beta blockers such as propranolol are a set of drugs designed to interfere with the stimulation your heart receives from your sympathetic nervous system and the hormonal effects of adrenaline. These drugs are typically used if the cause of high blood pressure is a rapid heart rate HR, aka primary hypertension. An overdose may cause seizures, hypotension, low BP, and bradycardia, low HR. Of TB fatalities reported to the OPC, 68% were associated with individuals younger than 50 years. 43% of all fatalities reported to the OPC in 2004 were associated with children younger than 6 years. Beta blocker toxicity in adults usually results from a suicide attempt or an accidental overdose of a routine medication. So you can see my apprehension of answering this question. Answer by Peter Clark. Can overdose of blood pressure pills cause death? A2A by Stephen Stripling. Yes, it can. Direct toxicity can happen, but other pathways are there also. If BP drops, a person may faint and bang ahead leading to death, or have an automobile accident leading to death. Excess of a beta blocker can compromise breathing, excessively slow the heart, or trigger heart failure. In 2014 there was amlodipine that led to cardiac arrest. Girl died after taking high BP tablets. Report, Times of India. ACE inhibitors leak Notebook can cause angioedema, shut off the airway. Angiotensin converting enzyme inhibitor related AMPs, /www. NCB, NLM, NIH. gov/pub/267255563. Get EMA, a case of an unexpected death. There are no safe medicines. They all have adverse reactions and risks. Use them as prescribed. Let your physician know about all of your medicines and supplements. If you have a bad reaction, notify your physician. Answer by Sandeep Pandurangarao. Yes, overdose can cause death either by drug itself or by lowering the BP too much that kidneys cannot adequately filter the blood to excrete the waste products. The venous return to heart gets reduced and other vital organs also get starved of blood supply. Within a few minutes renal shutdown ensues as nephron cells cannot regenerate and are very sensitive to oxygen lack. Blood pressure, BP, is a lifestyle disease like diabetes and very many others. No one should be branded as BP patient merely because of 12 recordings of pressure. Even if present, a trail of change in lifestyle and reducing salt and diet must be tried. If properly tried, half of the cases don't require BP medication. But who cares to hear saner voice?